Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Over the years, we've heard that omega-3 fats are good for us, especially with respect to our heart and cardiovascular system. Now, omega-3 fats are converted by the body into these mini hormones called prostaglandin series 3, which reduce the stickiness of our blood, helping to prevent the formation of abnormal blood clots. And these many hormones made from omega-3 fats also help to relax blood vessels so the blood can flow more easily to our tissues and to our brain. And also these many hormones made from omega-3 fats also help to reduce inflammation, which may be another way that omega-3 fats help to reduce the risk of heart disease. Now, studies over the years have also suggested that omega-3 fats may help to reduce high blood pressure, but clinical trials have produced mixed findings. Now, in June of 2022, after reviewing all of the available studies, researchers published a research review on this subject in the Journal of the American Medical Association, indicating that a daily dosage of 3 grams per day of omega-3 fats is the dosage that's required to help reduce high blood pressure. So if you're taking omega-3 fats and the dose is not at 3 grams, then it's probably not going to be beneficial. But if you get to 3 grams per day, very likely you'll see, if you have high blood pressure, a reduction to some degree. So researchers analyzed the results of 71 clinical trials to draw these conclusions. These trials were done all over the world and were published between 1987 and the year 2020. The studies examined the relationship between blood pressure and the omega-3 fats, DHA and EPA, which are found in fish and fish oil. And they looked at people who were who were over the age of 18 and older, with and without high blood pressure or cholesterol disorder. So there were nearly 5,000 participants in total, ranging in age from age 22 to age 86. Participants took dietary or prescription supplement sources of omega-3 fats for an average of 10 weeks. And the results showed the following. Compared to adults who did not consume these omega-3 fats, the ones who did consume 2 to 3 grams per day of omega-3 fats from fish and fish oil had reduced systolic and diastolic blood pressure by an average of about 2 millimeters of mercury. So there's a modest reduction. But consuming more than 3 grams of omega-3 fats a day daily may have added blood pressure lowering benefits for adults with high blood pressure or high blood lipids if they have high cholesterol or high triglycerides. At 3 grams a day of omega-3 fat intake, systolic blood pressure was reduced by 4.5 millimeters of mercury for those who had high blood pressure, and about 2 millimeters of mercury on average for those who did not have high blood pressure. So even people whose blood pressure wasn't high, it still helped them get their blood pressure even lower. But people who had high blood pressure, they saw a fairly significant reduction in blood pressure. Ingesting more than 3 grams per day of omega-3 fats did not produce a blood pressure lowering effect that was significantly better than taking 3 grams a day. So you don't need to take 5 or 6 or 7 or 9 grams a day. 3 grams seems to be the target. So roughly 3 grams per day of omega-3 fats appears to be a good target dosage for those with high blood pressure, whereas for people with relatively normal blood pressure, a daily dosage of 2 to 3 grams per day still appears to be beneficial to help prevent a rise in blood pressure as you get older. So there's still a benefit, even if your blood pressure is not high, to help keeping that blood pressure down as the years go by. Although you can obtain 3 grams of omega-3 fats from consuming 4 to 5 grams of Atlantic salmon, in most of these studies, participants actually ingested omega-3 fats from supplements. So common omega-3 fat supplements include fish oil, flaxseed oil, and certain types of algae oils. Now, fish oil supplements contain the EPA and DHA omega-3 fats highlighted in this study. But other studies have shown that omega-3 fats ingested from flaxseed oil can also reduce high blood pressure. And the same is likely true for algae oil, which contains this omega-3 fat known as ALA, or alpha-linolenic acid. I personally take 2 to 3 capsules per day of a supplement that contains fish, flaxseed, and borage seed oil all in one capsule, which provides the omega-3 benefits we're speaking about here, as well as other anti-inflammatory effects that you get from borage seed oil. So a combination of fish oil with flaxseed oil and borage seed oil, that tends to be my preference for overall general health and healthy life expectancy. So I've included the references for this information in the text below. Thanks for watching, and I'll see you next time.